I'm gonna have her scan the room for notes. So there are no notes. Before walking into my patient's room, I'm going to check the chart, check the doctor's orders. I'm gonna come in, provide privacy by pulling the curtain or shutting the door. I'm going to wash my hands, come in. Can you state your name and date of birth for me?
Caitlin Karen of 10/26/96.
Okay, I'm gonna check her wristband. All right. My name is Amory. I'm gonna be the student nurse today. What brings you in?
Just a checkup.
Just check. Are you experiencing any pain right now?
Nope.
Okay, I'm just inspecting the patient right now. The patient's skin is appropriate for her ethnicity. Skin is warm, no abnormalities. There's no lesions. She has her ears pierced but no tattoos. And then I'm going, is it okay if I palpate your? Okay. The hair is evenly distributed. The hair condition is good. It's clean. It's thick. And then I'm going to move on to the patient's neck. When the patient is laying down, her veins aren't distended, so she has no JVD. If they were, I would bring the patient up to a 45-degree angle and see if the veins still were distended. And then looking at the neck, I'm going to start by palpating the carotid arteries. Is it okay if I palpate your carotid arteries? Okay. Carotid artery is a +2 and +2 on this side. They're equally bilateral. And then I'm gonna go in. I want you to take a full breath and hold it, and I'm gonna use the bell of my stethoscope. And good, breathe out. And then I'm gonna do the other side. Take a deep breath, hold it. Good, breathe out. There were no bruises. And then have you had any neck pain, neck tenderness, stiffness?
Nope.
Okay, and then moving down to the upper extremities. The patient's upper extremities, the skin color matches the face and is appropriate for her ethnicity. I'm going to check for edema. The blanching of the skin goes back within 3 seconds. There is no pitting, so edema is a +1, which is no edema. I'm gonna check the brachial artery. Brachial artery is a +2. Move down to the radial. The radial pulse is a +2 as well. The skin is warm and dry, no moisture. Check the capillary refill. Good. The capillary refill goes back within 3 seconds, so the circulation is good. Going to the other arm. The patient does have some moles, no lesions, bruising, anything like that on the skin. No tattoos. The blanching goes back within 3 seconds. There's no edema, so edema is a +1. Check the brachial on this side. Brachial is a +2. Down to the radial. Radial is a +2. The temperature is warm and the skin is dry. Then the capillary refill. Capillary refill goes back within 3 seconds, so that arm is getting good circulation as well. Have you noticed any weakness in your arms?
No.
No? to the lower extremities. And then I'm going to have you take off your shoes for me. And your socks.
Sorry.
It's okay. All right, so observing the lower extremities. The skin matches the rest of the body. It's appropriate for the ethnicity. The temperature is warm. Skin is dry. Looking at the hair follicles, the hair is evenly distributed. There is a bruise on the leg. Do you know where you got that bruise?
I don't actually. I'm pretty clumsy.
Okay. And then there's no lesions, no cuts. There is a tattoo on the side of the ankle. And then I'm going, is there any tenderness when I do this?
No.
No. The blanching on the legs go back within 3 seconds. There is no pitting, so edema is +1. I'm going to check the popliteal pulse. I can't find it, so I'm going to check for the posterior tibial. Posterior tibial pulse is +1. And the posterior tibial is +1 on this side. I'm going to check for dorsal pedis. Dorsal pedis is a +1, and then I'm going to check the capillary refill. Capillary refill goes back within 3 seconds, so the leg is getting good circulation. Have you noticed any weakness in your legs?
Nope.
Tenderness, shaky knees?
Nope.
Okay, and then I'm going to put this back down for you.
Thank you.
Okay, and then I am going to come up and observe the anterior chest. Like I said before, skin is appropriate for the ethnicity. It's warm. And then just observing the patient right now. The patient her facial expressions relaxed. There's no respiratory distress. Have you noticed any difficulty breathing, pain while breathing?
No.
Okay, the patient isn't using accessory muscles to breathe. And then I'm going to percuss. Before I do that, I'm going to check the turgor of the skin. The skin goes back within 3 seconds, so patient is hydrated. And then I'm going to percuss. Okay. Was there any tenderness when I did that? No? All right. And now I am going to auscultate your lung sounds. Okay. Every time I move my stethoscope, I want you to take a full breath, okay?
Okay.
Good. There was no wheezing, rhonchi, or murmurs, wheezing, rhonchi, or crackles heard. And then I'm going to listen to your heart. Okay, still using the bell. Second intercostal down. Good, that's the aortic. Go over second intercostal. Pulmonic. Go down. Third intercostal is Erb's point. Good. Go down to the 5th intercostal over his tricuspid. Good. And then go down to the 5th intercostal mid-clavicle. Good. The S1 and S2 was regular. I heard no murmurs or abnormal sounds. And then have you noticed any problems with your heart?
No.
Have you ever had a heart attack?
No.
No? Okay. And then do you have asthma?
I do not.
Do you smoke?
Nope.
And then any troubles breathing recently? You said no?
No.
Okay. And then we're going to come over to the posterior. Sit up for me. Okay. And then looking at the patient's back, there are no lesions, no cuts, no masses. There are some freckles, but nothing to be worried about. Have you ever had back surgery?
Nope.
No? Any troubles with your back?
Nope.
Okay. I'm going to start by checking the A and P. Go down to C7. Check the end of the scapula, which is T7. Go down 3 spots. I'm gonna have you take a deep breath for me, okay? Good. The A and P is symmetrical. Then I'm going to feel the vibrations. Can you repeat 99 for me?
99.
Good.
99.
Good.
99.
Good.
99.
One more
99.
Good. The vibrations were strong on the top and then diminished towards the bottom, which is normal. And then I am going to percuss. Any tenderness when I did that?
Mm-mm.
Okay, and now I'm gonna auscultate. Every time I move my stethoscope, I want you to take a deep breath for me.
Okay.
Okay. You doing okay? Any lightheadedness?
I'm okay.
Okay.
You're dragging us along, whether you're wanting to or not.
Okay, there was no wheezing, rhonchi, or crackles heard. And that completes my chest video.